Characteristics of COVID-19 vaccines. mRNA Pfizer BioNTech COVID-19 vaccine. This requires ultra-cold chain storage at -80 degrees Celsius to -60 degrees Celsius at the national level. The vaccine is frozen liquid and requires to be diluted after thawing using 1.8 ml of diluents. Initial pandemic supply will not include a VVM and the dosage is 0.3 ml. It is a 5-dose vial, does not contain preservative, hence it is discarded 6 hours after reconstitution. 2 doses are required for full protection with a 21-day interval between each dose. Shelf life is different at various temperatures. 6 months at -90 to -60 degrees Celsius. 5 days at +2 degrees Celsius to +8 degrees Celsius. 6 hours at ambient temperature T degree Celsius after dilution. Handling mRNA Pfizer BioNTech COVID-19 vaccine. State level. At the state level, the insulated container containing the vaccine should only be opened when the distribution to service delivery points is to commence. The container should not be left open for more than 60 to 90 seconds at a time. At the lower level service delivery, the vaccine may be thawed in the refrigerator or at room temperature. In a refrigerator at +2 degrees Celsius to +8 degrees Celsius temperature range, 25 to 195 vials may take 2 to 3 hours to thaw. Fewer number of vials will take less time. At room temperature, up to +25 degrees Celsius, it takes between 30 minutes and 2 hours. Note: do not refreeze thawed vaccines. Handling mRNA Pfizer BioNTech COVID-19 vaccine continued. Steps for reconstitution of the vaccine. Remove vaccine from the freezer or refrigerator and allow to thaw at room temperature. Vials at room temperature must be mixed within 2 hours or returned to the refrigerator. With the vaccine at room temperature, gently invert vial 10 times. Do not shake the vial. If the vial is shaken, discard the vaccine. The vaccine is white to off-white in color and may contain opaque particles. Do not use if liquid is discolored. Note the date and time the vaccine was mixed on the vial. Discard any unused vaccine after 6 hours. Do not return to refrigerator or freezer for storage. Handling of mRNA Pfizer BioNTech COVID-19 vaccine continued. Steps for reconstitution of the vaccine. Using a new sterile alcohol-prepared pad for each vial, wipe off the stoppers of the diluents and vaccine vials. Using a 21 gauge or narrower needle, withdraw 1.8 ml of 0.9% sodium chloride, normal saline preservative-free, into a mixing syringe. Discard diluent vial and any remaining diluents. Do not use bacteriostatic normal saline or other diluents to mix the vaccine. Keep mixed vaccine at room temperature, +2 degrees Celsius to +25 degrees Celsius and administer within 6 hours. Discard any unused vaccine after 6 hours. Do not return to refrigerator or freezer for storage. mRNA Moderna COVID-19 vaccine. This requires working freezer room, WIFR, or freezer storage at -25 degrees Celsius to -15 degrees Celsius at the national level. The vaccine is liquid frozen and does not require reconstitution or dilution. The vaccine can be stored within +2 degrees Celsius to plus 8 degrees Celsius in refrigerators for 30 days only at the lower levels. After 30 days, remove any remaining vials from the refrigerator and discard. The vaccine is a 10-dose vial. The required dosage is 0.5 ml. 2 doses are required for full protection with a 28-day interval between each dose. Keep the punctured vial vaccine between plus 2 degrees Celsius to plus 25 degrees Celsius for up to 6 hours. Discard any unused vaccine after 6 hours. Note: gently swirl the vaccine vial before withdrawing subsequent doses. Handling mRNA Moderna COVID-19 vaccine. At the lower level service delivery, the vaccine may be stored in the refrigerator or at room temperature. In the refrigerator, at plus 2 degrees Celsius to plus 8 degrees Celsius temperature range. It takes 2 to 3 hours to thaw. At room temperature, up to plus 25 degrees Celsius, it takes 1 hour. Note: do not refreeze thawed vaccines. Vials that have not been punctured may be kept between plus 8 degrees Celsius to plus 25 degrees Celsius for up to 12 hours. With the vial upright, gently swirl the vaccine vial. Do not shake. If the vial is shaking, discard the vaccine. Note the date and time the vial was first punctured, as the vaccine should be discarded 6 hours after the first puncture. Handling mRNA Moderna COVID-19 vaccine continued. Gently swirl the vaccine before withdrawing subsequent doses. Discard vial when there is not enough vaccine to obtain a complete dose. Do not mix COVID-19 Moderna vaccine with a diluent. Do not combine residual vaccine from multiple vials to obtain a dose. Keep the punctured vial of vaccine between 2 degrees Celsius and 25 degrees Celsius for up to 6 hours. Discard any unused vaccine after 6 hours of puncture. Third vaccines are never to be refrozen. AstraZeneca/Oxford COVID-19 vaccine from Serum Institute of India PVT Limited. The vaccine comes as a ready-to-use liquid formulation and does not require dilution. It is a 10-dose vial with 0.5 ml dose given intramuscularly. The vaccine should be discarded 6 hours after uncapping and withdrawing of the first dose. It has different shelf life at different temperatures, with 9 months at plus 2 degrees Celsius to plus 8 degrees Celsius. 30 days at plus 25 degrees Celsius, study undergoing. Given as 2 doses schedule, 28 days interval between first and second dose. Has no preservative and no VVM. The vaccine is stored in refrigerators with a temperature monitoring device within temperatures of between plus 2 degrees Celsius to plus 8 degrees Celsius. Johnson & Johnson. The recommended dosage to achieve full protection is 1 dose at first contact. The vaccine has no preservative and vaccine vial monitor (VVM). The vaccine must be stored in refrigerators with a temperature monitoring device within temperature range of plus 2 degrees Celsius to plus 8 degrees Celsius. The vaccine does not require dilution. COVID-19 vaccine administration. Keynotes on COVID-19 vaccines. COVID-19 vaccines are not interchangeable. If a client is vaccinated with a particular COVID-19 vaccine, e.g., AstraZeneca, the second dose received must be AstraZeneca. Storage conditions are specific for each vaccine. Gentle swirling for Moderna COVID-19 vaccines is a key prerequisite before withdrawal of subsequent doses. The Pfizer mRNA vaccine should be inverted 10 times gently after dilution. Pfizer, Moderna, and AstraZeneca COVID-19 vaccines should be discarded after 6 hours or immediately after each session, whichever one comes first. This has been brought to you by the National Primary Healthcare Development Agency.